Hi everyone, and this is Dr Eyetemou Miguel. Welcome to my channel. In this new video, we are going to talk about an important topic. I have a lot of patients, some relatives that have been asking the question on the use of expired drugs. Should you use drugs after the expiration date? If yes, there are some people who suggest that you can still use it after 3 months or 6 months or 1 year after the expiration date. So what is the expiration date and how are we to deal about the expiration date? Are expired drugs still effective or are they highly dangerous? I'm going to give you answers to these questions in a few moments by sharing with you the results of 2 studies that were made on the subject. So let's start by defining expiration date. Expiration date is the final date that the manufacturer guarantees the full potency and safety of a medication. So you have until the expiration date, you have the guarantee that you are sure at 100% that the medication is effective, that it will have the expected desired result, and also that it's not going to harm your health in any uncommon way. Expiration date exists on most medication labels, such as prescription medication, over-the-counter medication such as paracetamol, and also on dietary herbal supplements. Proper drug storage may help to increase or to extend their potency over time. There are non-agile places for you to store your drugs where there are high levels of heat or humidity, such as bathroom, medicine cabinet, or hot car. And there are ideal places or ideal conditions such as a dry and cool place away from light with the bottle tightly closed, and you always keep your medicines out of the reach of children. Some medical authorities suggest that expired medicine is safe to take, even those that expired years ago. It's true that the effectiveness may decrease over time, as we are going to see, but much of the original potency still remains even a decade after the expiration date. Most medications are highly long-lasting. Placing a drug in a cold place such as refrigerator will help it remain potent for many years. And talk about the potency of medications. Medications' potency gradually decreases starting from the moment of its manufacture. So this process is not in any way spontaneous after the expiry date. So let's talk about the 2 studies. The best evidence that we have so far is the shelf life extension program SLEP, undertaken by the Food and Drug Administration for the Department of Defense. The aim of the study was to reduce the medication costs for the military, and the findings are as follows. They examined 122 different drugs stored under ideal conditions. They found that 88% of those drugs should have their expiration dates extended for more than 1 year. They found an average extension period of 66 months, equivalent to 5.5 years, and they found a maximum extension period of 278 months, that is 23 years and 2 months. The other study examined or analyzed 14 medications, 14 active ingredients found in 8 different drugs from a retail pharmacy that have been kept there for 28 to 40 years. And they found that out of 14 of those active ingredients, 12 were still at minimum required dosage after 336 months, meaning 28 years. And 8 out of 14 of those active ingredients were still at minimum required dosage after 480 months, which is 40 years. So these 2 studies suggest that it's still possible to use drugs after the expiration date. They are still effective, not at 100% for sure, but some are still effective. And you have to know before going forward that there are certain medications that have what we call a narrow therapeutic index. It means that a slight change in the dosage or in the blood concentration might cause or might result in a severe adverse effect in the patient, such as disability or even death. So these drugs should not at all be used beyond the expiry date. Among them, we have drugs like monoclonal antibodies, cyclosporine, warfarin, and digoxin. Now, beyond the expiry date, you should also check the stability of the drug that you want to take, even if it's before or after the expiration date. You have to make sure that your medication, your medicine is still stable physically and chemically stable. And the most stable forms are the solid dosage forms, such as the tablets and the capsule. They can last very long, but the less stable forms, or the most vulnerable and stable forms, are the liquid forms, solutions, drinkable solutions or injectable solutions. If you notice any precipitant or that the solution becomes cloudy or changes color, you should discard the solution right away. It's no more safe, it's no more stable. So in summary, the rule applies to all drugs. After the expiration date, there's no guarantee of potency and of safety, so you have to avoid it. We have seen some studies, those two studies, that show that some medications can still be used after the expiration date, and going as far as 4 decades is possible. But in science, and in particularly in health, in the health domain, we don't work on probabilities, we work on evidences, we work on guarantees. And the only guarantee that you have when you take a medicine is the guarantee of its effectiveness, of its safety, and of its potency until the expiry date, until the expiration date. There's no guarantee that you have beyond. Because talking about those two studies, we have to notice that the studies were not performed on all medications available all over the world. That would be impossible to do a study like that. And also the other fact is that those drugs were stored in an agile environment. That's not always the case, mainly in my country, Cameroon, or in Africa in general. These are hot places where you have high levels of heat and humidity. So in such a climate, in such a context, it's even more dangerous to take expired drugs. Now you can find yourself in a situation in which you are obliged, in quotes, to take an expired drug. For example, you find yourself in a village far away from the city, where you don't have any pharmacy, you don't have any health provider, and you just have your expired drug. So in such a context, because you don't have any better alternative, you can take the expired drug to save the life of the patient. But you have at least to make sure, or to check the stability, the physical and chemical stability of the drug. When you find yourself in an environment where you are near a pharmacy, you are near a hospital, you have a better alternative of drugs that are not expired. It will be dangerous to take expired drugs, because that will mean that you venture into an unknown domain, and you might be healed, but you might also get some damages to your health. Thank you for having watched the video. I hope you found some answers to your questions about expiry date and expired drugs. If there are some aspects that I haven't touched, let me know in the comments below, and maybe I'll make another video on the topic. And please consider liking the video, sharing, and also subscribing to my channels.